Good morning and welcome to Gin and Tonic. At Hilton Medcare, we've got a lot of passionate practitioners, and one of them is Michelle Alberts, dietitian. So welcome, Michelle.
Thank you.
And we are going to talk today about eating disorders. So I'm going to hand it over to Michelle.
Thank you. Eating disorders is an area of dietetics that I'm really passionate about, and I'm going to start slightly differently with atypical anorexia. Most people are familiar with the regular anorexia and bulimia, but atypical anorexia is something that is often undiagnosed, purely because it's usually your overweight patient who's lost weight, and everybody compliments them about their weight loss, generally praises them as social acceptance, as you should fit a specific type. And especially with social media nowadays sort of promoting weight loss. I mean, if you open your Facebook pages these days, you'll see how many weight loss products, or especially this time of year, get your body summer ready. And a lot of them are not healthy ways of losing weight. So atypical anorexia is your patient who is generally overweight, loses weight, but in an unhealthy manner. You get then anorexia, which most people are familiar with, and that is typically your underweight patient that you see who's lost weight. You get, I'm just doing a very brief overview, then bulimia, which is your patient who, they can often be slightly overweight. They don't typically, they're not typically underweight, and they either purge, which is vomiting. They might use laxatives or diuretics as a weight loss, or excessive exercise. And those patients you can often pick up, especially if they're purging. They often have enlarged glands, and if you look at their hands, you can see the bite marks from gagging on their hands.
Oh, wow. Okay.
And if they also often sore throats, throat infections. If you chat to them, their breath smells nasty. And often their teeth are corroded, because as most people, once you've vomited, you want to brush your teeth, and they'll end up doing damage to the enamel from so much purging.
Sure. So would you say that there's a link to mental health?
It's very closely linked to mental health. It is probably it's one of the mental health issues that it's got a very high mortality rate.
Yeah.
Sadly. Statistics in South Africa we don't have, but if you look statistics worldwide, disordered eating starts anything from the age of 5.
Sure, as young as that.
Very common in teens when they hit puberty, and just if you're looking in the family settings, and that's where it often goes undiagnosed, or parents want to bury their head in the sand, very sadly. But it's what things they see at home. Has mom been on diets all the time? They then feel they need to. How do we speak about bodies at home? Sadly, in society, people comment on somebody's body shape. They don't comment if somebody's wearing glasses.
Yeah.
It's sort of acceptable. But a body shape they do. And depending on somebody's emotional state, I've even seen now with a lot of school curriculum, what's in the school curricula, you should be having so many calories. It's very different from child to child. So why are we teaching kids about calories, not just general healthy eating? And what is healthy eating? A very simple rule I use is all foods fit. So even having a sweet and a biscuit, that's part of normal eating. The moment you start stigmatizing you can't eat that, that is something that's going to trigger disordered eating. One of the other ones, you also get something called orthorexia, and that is often your typical dieter who is seen as just being very healthy because they become obsessed. I can't have sugars, and that's where it starts. And then, I can't have sugars, and they take it to the extreme. Well, sugars you find in fruit. I can't have fruit, and it becomes more and more restrictive. You also get, on the other scale, binge eating disorder, which I see a lot in the mental health field I work with, is coping with emotions. People turn to food.
Yeah.
And it's generally high fat, high carb foods. And then it's the secretive eating, hiding of wrappers, eating very fast, being ashamed of eating. So there's lots of...
So it's quite a huge...
It's a huge field, and sadly often very neglected. Fortunately in Maritzburg we have some phenomenal psychiatrists that are able to pick it up. There are also some good doctors, but sadly a lot of it goes undiagnosed.
So how can we help our children in the best possible balanced way to first of all try and prevent anything in terms of either side, or also try and identify it as early as possible?
So in terms of, if I could say, normalizing food and weight at home, rather discuss things like the strength of your body, not body shapes. Nobody, if you look in society, even if you just take, I'm going to use a simple thing, hair color. Nobody's got the same hair color. So why must we all have the same body shape?
Yeah.
So rather discuss things like strength or what abilities you do have, rather than focusing on a body shape. Then look at eating. One of the big things I find that is a big identifier is, do you eat together as a family? And sadly it doesn't happen. If you're not eating together as a family, you're not actually seeing what are your children eating.
Yeah.
And that's an easy way for children to say, oh, I've eaten already, get away with it, or they have 3 helpings. So rather try and have, I know in today's society with how our lives are, we can't eat all meals together, but if we can just try and have supper together, ideally around a table, it's a lovely way to connect, see how your kid's day was, where the difficulties are, and then you can see, is your child eating their whole meal? Are they avoiding certain foods? Cutting up food and looking like they're eating, or going back for 3 helpings, feeling unsatisfied. And if they don't feel satisfied, it's often an emotional issue. Also, do you force your child to finish their food? It's a very fine balance, but children have a very intrinsic sense of satiety and hunger, which a lot of adults no longer have, because we were brought up, you need to finish your food on your plate, so you eat past that stage of hunger, whereas our children can say, okay, I'm full now. So for me, that's a really key factor.
If a mom is worried, can she bring a child directly to you?
She can. I quite enjoy having involving the family, especially younger children. I normally in a session I involve the parents. I then ask the child would they prefer their parent to leave, and we can chat freely. So it's a free space for them to talk about food. And often you can see, things I've seen in practice are things like sweets or biscuits, or I hate the word junk food. I prefer foods that we eat less often, because they all form part of our diet. Reality is the lifestyles we lead. But if you say you can have it, you're taking that element away of, I'm not allowed it, I've got to have it. Because adults are the same. If you can't have something, you almost, well, I'm going to be defiant and I'm going to have it. So if you normalize having things like biscuits and sweets occasionally, it takes that away, that binging need away. And you're normalizing food. It becomes the same as, I can eat an apple.
Yeah. So in your opinion, what would be like a healthy way to encourage healthy eating, in terms of, especially if you see things are going a little bit one way or the other, how does one, in a balanced, healthy way, try in the early days to rein that back?
Hopefully you've got a good relationship with your child. I just want to say, most people have this stigma or idea that eating disorders is girls, ladies. Very sadly, there is a high prevalence of males, but it goes undiagnosed. So if you can have open relationship with your children about, chat, how do you feel about your body? I was reading something the other day about 3 in 5 teenagers in Australia are dissatisfied with their bodies.
Yeah. So is that body dysmorphism, or is it
it's just body image dissatisfied?
Yeah.
You know, they might see their friends wear something and they don't feel comfortable in it, or somebody's commented. So it's to try and have as much open relationship. If your child is starting to feel uncomfortable in their bodies, it's okay, what do what's going on? Maybe we can increase more veg in the diet, because maybe that's what at home time hasn't allowed it. I have a lot of patients who say to me, hey, vegetables are expensive, we don't have time to cook them. Simple thing, buy what's in season. Buy frozen vegetables. There's nothing wrong with frozen vegetables. Unfortunately, some people don't like the texture, so then you need to find the balance that works for your family. Just changing things slightly in your family to make food. Get your children involved in cooking, because often your child who is anorexic will either cook and not eat or avoid food as much as possible. So if you start normalizing behavior and involvement around food.
So it sounds to me like very individual type of, fixes or attempts to fix. But also it sounds to me like there's quite a large element of mental health involved in this, and mental health of the whole family.
It is. Sadly, with eating disorders, I've seen a huge number of families become broken because of eating disorders. Either one parent is so involved, or they just cannot cope with what's going on. So it's really important to involve a variety of health practitioners. If you can, a psychologist, a psychiatrist, if needing medication, and being as open and honest with your healthcare practitioner as possible. The earlier the intervention, the quicker you can solve it. Otherwise, it is years and years of trouble.
Yeah, so worst case scenario, the major complications?
Major complications in young ladies, they have dysmenorrhea or amenorrhea, can affect fertility issues, affect your heart. So if somebody is severely anorexic, you can't just go from eating minimal to a normal diet, otherwise you will cause complications. You can have organ damage, bone health especially is one of the biggest problems. Also, the lower your weight is, the more obsessed you become by food, and your thought patterns aren't what they should be, but you think you're thinking fine.
Yeah, so I think it's like a spiral that just really deteriorates.
It is. I'm not hugely weight focused, but you have to look at weight, especially the lower, especially if it's a child, where their weight is, so that they don't become in a critical condition. But it's a very holistic, multidisciplinary approach that works.
And I think that's what we're trying to do here at Hilton Medcare, is always have that holistic team approach. Speak to the other members of the team, all be on the same page. The patient is also a member of the team, and they must feel that way. They must feel empowered to actually say to their doctor, I don't agree, or I don't want to take this treatment for this reason. I think that's also quite important, because if you autocratically try and prescribe things, especially I think in this scenario, I think you either lose the patient, or you lose the battle, or you lose both, and that's a tragedy.
It is. It's you've got to involve the patient as much as possible. There are some times where you have to say to the patient, it's not negotiable.
Yeah.
Especially when it comes to food, they might say they're not prepared to eat. Generally, it's they're not prepared to eat a carb and they're not prepared to eat a fat. Well, that doesn't form part of a healthy diet. So you do it, if I could say, in a gentle manner. What are you prepared to do first, and then build it up. but it also involves families, especially if they're teens.
Yeah. So thank you, Michelle. I think that was very insightful. I think there's so many things that we can do better in society, mental health wise, and definitely if we use this holistic approach, I think we can win more of the time then.
We can.
Yeah.
I've fortunately had a couple of counsellors recently at schools that are really on board and have picked up problems. And early intervention, we've seen huge progress with it.
Yeah.
But if I can give you one take-home message, please try not to comment on body shape.
Yeah. I think generally in South Africa we need to learn to be less critical of anything and rather say something positive or don't say something.
I think that's a lovely message.
Thank you.
Thank you.